Collaterals are great. So I talk to my patients about the, major construction on a freeway, right? So your named blood vessels are a freeway and cars are driving down that road to deliver oxygen down to your feet to get your muscles the blood flow they want to help you walk and run and exercise. And, if there's just a crash suddenly on the freeway and traffic backs up, there's usually not a great system to like go around because everybody wants to get off at the next exit and then that side road gets really crowded and congested and it's not really better. Maybe you're moving, but you don't get there any faster, right? But if they start doing a huge, like years long construction project, they're putting in, the tunnel or something, building a subway, then that construction is going for years. And that area where there's a lot of traffic and congestion, everybody starts getting off and using the county roads instead. Well, then the county wises up and says, hey, the freeway's blocked. Maybe we should add a lane to the county roads because everybody's taking the county roads. And so over time, now your county roads get bigger and they allow more cars and trucks to flow so you can get around that huge snarl of traffic on the freeway. So that's what collateral vessels are. They're just county roads that are going around the area that's narrowed or blocked. But you have to tell the county to build another lane. And how do you do that? You put pressure on it by using it over and over and over again and proving to them that it's going to be beneficial, right? There's more cars, there's going to be more traffic, there's going to be more business here. It's going to be worth the cost because it's costly to add infrastructure. It's costly to add blood vessels. So you have to prove to your body that it's worth it. And that means challenging the body and providing a stimulus to drive that very energy intensive process. What's that stimulus? It's demanding oxygen. What is the best thing that demands oxygen? Muscles. So using your muscles, like walking, is usually the best way to develop those county roads and those collaterals because you are just asking your body to get that oxygen there and you're doing it over and over and over again until it can't ignore you. The hard part is that that's a lot of work and it's often pretty uncomfortable, especially if that blockage is causing so much traffic that you're not getting oxygen and your muscles are screaming about it, right? Those muscles get really unhappy when they don't get oxygen. They cramp, they burn. It's painful. And I haven't personally experienced it from blood flow blockage, but I exercise and I can appreciate what muscles feel like when they're working really, really hard and not getting enough oxygen. And it hurts. It hurts. I get it. But it's also the signal that drives growth and it drives the formation of those county roads or those collateral networks, and they will save your leg. I mean, they absolutely will. If you can take the time and build that up over months to years, it's very clear when we do angiograms who has built up these collateral networks over years. I mean, it's just so clear. You see all of these little county roads, and none of them have names, but there's hundreds of them, and they go around the blockage and clearly provide an incredible amount of blood flow to the leg that has gotten this patient through years until they get to us.